My name is Carl Wierks. I'm a board-certified, fellowship-trained orthopedic surgeon practicing in West Michigan Orthopedics in Grand Rapids, Michigan. This video will briefly describe labral tears of the hip. The labrum of the hip is a cartilage ring that surrounds and seals the hip socket. It adds stability to the joint through this suction seal. It is often injured or torn if there is a shape mismatch between the ball and the socket parts of the joint. These shape mismatches can develop during adolescence and result in a labral tear, especially in athletes or other active people. High hip flexion sports such as soccer, ice hockey, gymnastics, or dance are frequent causes. Runners, though, can also develop a labral tear due to repetitive hip flexion activation. A labral tear is painful because it is densely innervated with pain fibers, almost like a fingertip. The pain is typically exacerbated with hip flexion positions such as deep squatting, lunging, or dynamic activities such as jumping or distance running. While the labrum has many nerve endings, it does not receive very much blood supply, which limits its ability to heal. If a labral tear is diagnosed, conservative treatment options are recommended first, including avoiding painful activities, formal physical therapy, and a course of anti-inflammatory medications such as ibuprofen. If symptoms persist for over 3 months, despite these conservative treatments, surgery may be an option. Surgical repair of the labrum involves an arthroscopic or minimally invasive procedure. The repair is typically performed using high-strength, non-absorbable sutures that loop or lasso around the labrum and are then secured into the adjacent hip socket bone using surgical anchors. Any underlying bony shape mismatch is also corrected to protect the labral repair. These are outpatient surgeries that are typically performed in under 2 hours, but do require crutch use with partial weight bearing afterwards for 3 weeks and guided physical therapy for 2 to 3 months. If you are having restrictive hip pain that has lasted more than 6 to 8 weeks, you could start your evaluation with a primary care provider, a physical therapist, or myself here at West Michigan Orthopedics.